sleep physiology. What affects sleep physiology? Decrease in light, decrease light like in nighttime, and decrease stimulation of suprachiasmatic nucleus, which causes increase in norepinephrine from superior cervical ganglion and melatonin from pineal gland. So if there is decrease in light, like in nighttime, when there is darkness, you have decreased stimulation of suprachiasmatic nucleus. Suprachiasmatic nucleus is what governs the circadian rhythm as well, regulated by circadian rhythm in the superior chiasmatic nucleus. From superior cervical ganglion and increase melatonin from pineal gland. Now, next is EEG, electroencephalogram. So we're going to discuss the sleep waveforms that are governed during the sleep. When we're awake, which is uh, which is essentially when our eyes are open, we are awake, we are alert. That is beta waves on EEG, and beta waves are high frequency and low amplitude. When our eyes are closed, like you can see on the right side of the screen, right side is when eyes are closed, and that is alpha waves on a EEG. Of sleep, when we're sleeping, non-rapid eye movement, NREM, and REM sleep. So those are the two big chunks of sleep. NREM further has three stages: N1, N2, N3. N1 is only 5% of the sleep, and N1 is what is called as light sleep, and you experience theta waves on EEG. N2, during N2, you see sleep spindles and K complexes, and if you see another arrow goes towards the teeth, the teeth is for teeth grinding. Bruxism, and K spindles, K complexes are something you see on N2 stage. N3 is in red. So N3 stage is 25% of the times, and during N3 stage, you experience bedwetting, sleepwalking, night terrors, those three things. And there is something known as delta waves, like Delta Airlines. So waves. Delta waves are low frequency, high amplitude. On the right side of the screen, you can see this person is depressed. He's crying, she's crying. So depression is uh, primarily affects REM sleep. During REM sleep, you have loss of muscle tone, which is called atonia, except you do not have loss of diaphragmatic extraocular muscle tone, and you also have increased oxygen usage during REM sleep. However, pulse and blood pressure can vary. So, main uh, symptoms of REM sleep disorder are dreaming, nightmare, penile clitoral tumescence, and um, one way to diagnose to catch REM sleep disorder on a vignette is when they say that patient remembers their dreams. REM for remember, that is REM sleep disorder. A few more things that can affect REM sleep behavior disorder is uh, Lewy body dementia and Parkinson's disease. Moving on, factors in general that can affect sleep. In this screen, you can see alcohol, benzodiazepine, barbiturates. These three things, alcohol, benzodiazepine, barbiturates, decrease N3 sleep and REM sleep. Benzodiazepines are useful for sleep, waking, and night terrors. Disorder, crying, remembers everything about, um, his home, homesick, stuff like that. So moving on, aging also decreases N3 and decreases REM sleep. However, there is increased sleep onset latency, early morning waking. In their 80s, 90s year old, they have decreased N3. Bottom line, N3 stage of non-rapid eye movement is always decreasing. REM sleep decreases, increase sleep onset latency. So the latency increases, and then you also have early morning awakening. Again, depression like we discussed just now is about REM sleep disorders. So REM sleep increases, N3 decreases all the time in all the factors, right? Like alcohol, aging, depression, narcolepsy. Every time N3 decreases, there is also early morning awakening. Now, next would be narcolepsy. Narcolepsy, you have decreased REM latency. So, sleep physiology would be incomplete if we do not discuss thalamus, pituitary, and epithalamus. Let's discuss about hypothalamus in a nutshell. So, hypothalamus is located here in orange shade, and green is thalamus. Hypothalamus has uh, six main nucleuses. These are, if you, this is the pencil that is for. mm So the pencil is anteriorly, and this is posterior view. So posterior nucleus, green is anterior nucleus, um, ventromedial, supraoptics, suprachiasmatic. So lateral nucleus, let's discuss about lateral nucleus, the yellow one. Is stimulated by ghrelin, and it's inhibited by leptin. Lateral nucleus with hunger. So stimulated by ghrelin and inhibited by leptin. Ventromedial nucleus, VM, ventromedial nucleus here in red. This controls satiety and it's stimulated by leptin. Pathway, posterior nucleus in purple. This controls heat. You can see this picture of heat. So posterior nucleus controls heat, and heat, as we know, is a common feature of sympathetic adrenergic system. Suprachiasmatic nucleus, SCN, we just discussed that. Supraoptic nucleus, and paraventricle. So supraoptic synthesizes ADH, paraventricle, however, produces oxytocin. So paraventricle, oxytocin, supraoptic, ADH, preoptic nerve nucleus, preoptic nucleus. This controls GnRH release, thermoregulation, sexual behavior. Producing neurons to migrate from olfactory pituitary can cause Kallmann syndrome. Ventromedial injury may cause massive hyperphagia, and you can also see ventromedial nucleus injury in something called as craniopharyngioma. This is in a nutshell lateral hunger, ventromedial satiety, posterior nucleus heat, and um, system like anxiety, anger. So that is all sympathetic nervous system. Suprachiasmatic nucleus, circadian rhythm, supraoptic, paraventricle causes ADH, paraventricle is oxytocin, preoptic nucleus is GnRH release.